Hello, my name is Alex Queen. I'm the assistant editor of American Journal of Medicine. I'm here with Dr. Alpert, our editor-in-chief, and today we're going to talk about a few articles we have coming up. So in this issue, we have an interesting article about synthetic cannabinoids. Dr. Alpert, can you tell us a bit about this?
Yes, well, this is a very interesting article in a series that actually has originated in the state of Mississippi, where they're sending out little blurbs to the docs with 10 points on a number of clinically highly relevant issues. And this one has to do with these synthetic cannabinoids. Now, synthetic cannabinoids, people call it, it's artificial marijuana and so forth. It's nothing like that. In fact, these are drugs that were engineered by our pharmaceutical industry in the past in order to see if they could have some clinical usefulness, for example, for stimulating appetite in people who were receiving chemotherapy drugs and so forth. Unfortunately, the formulas got out into illicit hands, and laboratories have been set up, and they're manufacturing these and selling them very inexpensively throughout the world, and it's become a huge medical problem here in the U.S. They're manufactured mostly in China, and when they get here, they're sold often just over the counter. Anybody can buy them. They're not restricted, or at least they keep changing the formula so they're one step ahead of the restrictions. And these have been associated with thousands of emergency room visits. Patients have had heart attacks. Patients have had psychotic breaks, arrhythmias. Some patients have to be hospitalized in intensive care units. They're a huge problem, and of course part of it has to do with you don't know what dose you're getting, and some of them are so powerful that they stick to the cannabinoid receptors in the brain in a way that marijuana's active ingredient, tetrahydrocannabinol, THC, doesn't do. It's much more transient, so there are some huge, terrible side effects with this drug.
Okay, so what specifically does the clinician need to know about?
Well, the clinicians need to be aware that these drugs can cause all kinds of very, very nasty events, such as psychotic break, hallucinations, even myocardial infarctions, heart attacks, arrhythmias, and so forth. The patients often present sweating, shaking, going through all kinds of what are clearly very dangerous, potentially risky behaviors. And the clinicians need to be aware that these drugs are out there, they're available over the counter at local head shops, and they're used very, very commonly, and they can produce a whole range of nasty stuff. The treatment, we don't have a specific antidote for this drug yet, but the treatment is usually tranquilizers, and clearly if the patient is having major issues, they need to be hospitalized until the effect of the drug wears off, and that may take a while because these drugs hang around for a long time in the central nervous system.
Okay, thank you, Dr. Alpert.